Today is February 2nd. Before entering my patient's room, I'm going to check the door for any precautions to make sure that I have the proper PPE before entering in the room. While I enter the room, I'm going to be applying my hand hygiene. I'm also going to be looking and inspecting the room just to make sure that there's nothing that could harm my patient or I. Hello, my name is Maria. This is my preceptor. Today I'm going to be doing a physical assessment that's going to take about 15 to 20 minutes. Is that okay?
Yes.
Yes. Do you have to use the restroom?
No.
No. All right. Are you allergic to any to latex?
No.
No. Yeah, I'm going to be applying my gloves. All right. Can I check your wristband? Can you tell me your name, your date of birth, and where we are today?
William Garzon, 10/23/2000, Memorial Hospital.
Okay, my patient is alert, awake, and oriented, ×3. After I finish inspecting the room and check to see if my patient is awake, alert, and oriented, ×3, I am now going to remove my gloves, do my hand hygiene, and apply a new pair of gloves. I'm now going to start off with the head. I'm now looking at hair distribution, any lesions, any moles. Make sure that the head is symmetric to the rest of the body. Also, any signs of alopecia. My patient seems to be normal cephalic. Now I'm going to be inspecting the nose. Have you ever had any nose surgery?
No.
No? Any difficulty breathing?
No.
No? Okay. Do you mind tilting your head back? Alright, now I'm inspecting inside the nose for any septum deviation, lesions. Make sure that the hair follicles are evenly distributed. Also for any excess drainage. Alright, you can tilt your head back. Alright, I'm now going to ask you to close your eyes. I'm going to let you sniff something. I'm now checking for nose flare. While you sniff something, do you mind just with your index finger holding on to one side? Alright, tell me what you smell.
Coffee.
Coffee, alright. With the other one?
Coffee.
Alright. Cranial nerve 1 olfactory is intact. Okay, now I'm going to assess the eyes. Have you had any eye surgeries?
No.
Do you wear any prescription glasses?
No.
Do you have any discomfort in your eyes?
No.
Alright. I'm now going to be checking his conjunctiva to make sure it is pink and moist. I'm checking his sclera to make sure it's white. Now I'm going to be checking his pupil size, which is 3 mm and it's brisk. Do you mind reading my badge?
Maria Zeus,
Can you read that sign for me?
Broward College.
Okay. I was looking to make sure that his eyes dilate. Now I'm going to be checking to see if the pupils constrict. I'm going to be flashing one light on one eye and while looking at the other. Okay. Do you mind checking my following my pen light?
Mm-hmm.
I'm going to be checking for cross-eyed. Okay. Follow my pen light. Ocular motor cranial nerve 3. Abducens cranial nerve 6. Ocular motor cranial nerve 3. And the right eye is trochlear cranial nerve 4. Ocular motor cranial nerve 3. Abducens cranial nerve 6. Ocular motor cranial nerve 3 and trochlear on the left eye cranial nerve 4. Okay. Cranial nerve 3, 4, and 6 are all intact. Now I'm going to assess the face. Do you have any pain on your face?
No.
No? Okay. So I'm going to be palpating the forehead. I'm also going to be palpating the sinuses. I'm also going to be checking to see if there's any edema, any lesions, any bumps. I'm also going to make sure that the eyebrows, the eyes, the nose, and the mouth are all symmetrical to one another, and the face. Okay, do you mind puffing up your face, puffing your cheeks, okay, raising your eyebrows? Okay, now I want you to close your eyes and I want you to tell me which side you feel.
My left cheek. Right cheek. My forehead. My nose.
Okay, cranial nerve 5 and 7 are intact. Now I'm going to assess the ears. Do you wear any hearing aids?
No.
Do you have any discomfort in your ears?
No.
No? Alright, I'm going to be looking at both of the ears to make sure that they're symmetrical to one another and also to the rest of the body and the head. I'm going to lift up and out since he's an adult, and I'm going to be looking inside for excess earwax, any lesions, any bumps, any abnormalities. I'm going to repeat the same step on the other side. Do you mind turning that way for me? Thank you. Alright, so again, lift up and out. You can also just check inside for the same thing. Then I'm going to palpate the back of the ear for any tenderness. And also I'm going to be checking on both sides for any skin integrity. Okay. And now I'm going to be doing a hearing test. So I want you to close your eyes, and also I want you to close one side of your ear. And I'm going to repeat a word and you're going to repeat it after me, okay? I'm going to whisper a word and I'm going to ask you to repeat it after me.
Cookies.
Okay, do you mind doing it on the other side?
Blueberries.
Okay, cranial nerve 8 is intact. To assess the mouth. Have you had any recent surgeries in your mouth?
No.
Do you have any discomfort or pain?
No.
No? Okay, do you mind opening your mouth for me, please? Alright, now I'm looking at the soft and hard palate. I'm also looking for any lesions, any signs of infection. Okay, do you mind lifting your tongue up for me? I'm now checking the frenulum to make sure it's midline. Do you mind sticking out your tongue and going, ah? I'm now checking the uvula to make sure it's midline and the gag reflex is fine. Okay. Do you mind sticking out your tongue for me? Okay, do you mind moving it to the right, left, up, and down? Okay, you can set it back in. Now I'm going to be palpating also the trachea to make sure it's midline. Okay. Cranial nerve 9, glossopharyngeal, cranial nerve 10, vagus, and cranial nerve 12, hypoglossal are all intact. Now I'm going to assess the shoulders. Do you have any pain in your shoulders?
No.
Have you had any recent surgeries or no discomfort?
Mm-hmm.
Okay. So now I'm just going to look and inspect the shoulders for any lesions, any bumps. I'm also going to make sure it's symmetrical to the rest of the body. I'm going to now test for his strength. While I push down, you're going to push it up, okay? Okay. Now I want you to push up while I push down. Okay. Now I'm going to be checking his range of motion with his head. Do you mind looking to the right, the left, up, down? Can you move your head counterclockwise in a circle? Counterclockwise. The other way. Okay, you can stop. Cranial nerve 11. accessories is intact. Now I'm going to assess the neck. Before doing anything, I'm going to inspect for any lesions, any unusual moles, also anything palpating abnormally. Okay, I'm gonna be checking the carotid artery. Doing so, I'm gonna just check the pulse on one side, vice versa on the other. The pulse is +2, which is normal. Now I'm going to be checking his jugular vein. Do you mind going on your elbows? I'm going to put him in a 45-degree angle. Do you mind looking that way? Thank you. Using my pen light, I'm just going to check for bruits. All right. And the neck is intact. Now I'm going to assess the thorax. I'm now going to look for any abnormalities, any lesions, anything that could be concerning. Have you had any surgeries recently?
No.
On your thorax? No. Right now, using the diaphragm of my stethoscope, I'm now going to be listening to the lungs. Bronchial, louder during expiration. Now I'm going to be going in the mid-clavicle. Vesicular, louder during inspiration. Vesicular, louder during inspiration. Bronchial vesicular in the second intercostal space, right of the sternum border. Bronchiovesicular in the second intercostal space on the right side of the sternum border. Bronchiovesicular on the third intercostal, louder on the right side of the sternum border. Bronchiovesicular on the third intercostal on the left side of the sternum border. Bronchiovesicular on the fourth intercostal space on the left side of the sternum border. Bronchiovesicular on the fourth intercostal space on the right side of the sternum border. Those are all equally louder during inspiration and expiration. Now I'm going to go on the fifth intercostal space, which is on the midline of the nipple, and I'm going to listen to vesicular sounds on the fifth intercostal space, which is louder during inspiration. All right, now I'm going to assess the back. Now I'm gonna again check for any lesions, bumps, anything abnormal. Now again, using the diaphragm of my stethoscope, I'm gonna listen to the lung sounds. Okay, I'm looking for T4, so right here. Bronchiovesicular, 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 which are all equally loud during inspiration and expiration. Vesicular and vesicular, which are louder during inspiration. Now I'm going to be checking if it's for bilateral expansion. Can you breathe in for me? Now for the AP diameter, just to make sure, I'm gonna check. All right, now the back and the thorax is intact. Now I'm going to assess the heart, and I'm gonna be listening to the heart sounds using the diaphragm side of my stethoscope, starting with the aortic, which is on the second intercostal space on the left side of the sternum border, where S2 is louder. Then I'm going to go on the pulmonic on the second intercostal space on the right side of the sternum border, where S2 is louder. I'm going to go on Erb's point on the third intercostal space on the right side of the sternum border, where S1 and S2 are equal. Then I'm going to go on tricuspid, which is on the fourth intercostal space on the right side of the sternum border, where S1 is louder. Moving down, I'm going to go on the fifth intercostal space on the right side of the sternum border, where S1 is louder, which is mitral. Then on the midline of the nipple, I'm going to go down to locate the apical pulse, which I'm going to sit here for 1 full minute and listen. And the heart is intact. Now I'm going to assess the abdominal area. Have you had any abdominal surgeries?
No.
Do you feel nauseous?
No.
Have you had any bowel issues?
No.
Any problems urinating?
No.
Alright, now I'm going to inspect. Now I'm going to inspect and I'm going to see for any bumps, any lesions, any abnormalities. Once I see that, I'm now going to locate the abdominal aorta. By locating that, I'm going to look for the xiphoid process, go down, and then move to the left. So I'm going to do that. And the way I'm going to listen to that is using the bell of my stethoscope. And I'm going to listen to any bruits for a full minute. Once I do that, I'm going to go to the 4 quadrants and I'm going to listen to any bowel movements, any bowel sounds using the diaphragm of my stethoscope for a minute. If it's 5 to 35, it's normal sounds. If it's less than 5, it's hypoactive. If it's higher than 35, it would be hyperactive. So I would start with the lower right quadrant for a full minute, going up in a rainbow shape. Again, for a full minute each. Okay, once I listen to that, I'm now going to palpate again with going the rainbow, like a upside down U on each quadrant to palpate. Now I'm going to ask my patient, have you had any testicular examination?
No.
No? If my patient says no, I'm going to direct them with some information so they could have this examination done and give them a way to get it done. And the abdominal area is now intact. Now I'm going to assess the upper extremities. Now I'm going to inspect for any signs of signs of edema, any lesions, moles. Make sure it's symmetrical to the rest of the body and they're proportionally even. Now I'm going to check his capillary refill to make sure it's brisk. I'm going to check his radial pulse, his brachial. Okay. Can you go subnation, pronation, flex, extend, abduction, adduction. Okay, now I'm gonna check for your strength. So I'm gonna push and you're gonna push out, okay? All right, now we're gonna do the other side. Perfect. And can you squeeze my hand? Can you squeeze the other hand? Okay, I want you to close your eyes and now you're gonna tell me which side you feel.
My left
Left what?
arm. My right arm. My right arm.
Where?
My bicep. My left bicep.
Okay. The upper extremities are intact. Now I'm going to assess the lower extremities. I'm going to make sure that the legs are symmetrical to the rest of the body. I'm also going to be checking for any lesions, any bumps, any signs of edema. And now I'm going to check his capillary refill to make sure it's brisk. Now I'm going to check the pulses, the dorsal pedis. Check this one, popliteal. All right. Now I'm gonna check his strength. Can you put your legs up for me? No, like your feet. Yeah. I'm gonna push, and you're gonna push for me. Other side. All right. Can you put this one up? This one down. Up. Down. Both up. Okay, both down. Can you wiggle your toes for me? All right, and the lower extremities are intact. Now I'm going to assess the back. Do you have any pain in your back? Any discomfort?
No.
No? Alright, now I'm going to inspect for any lesions, any bumps, any abnormalities. Then I'm going to palpate the spine and check for scoliosis, lordosis, and kyptosis. I'm also going to lift up the buttocks and check the anus for any hemorrhoids or anything abnormal. And after all that, we're all done with the physical assessment.